Dr. Gorrin explains the parts of the ARTAS device.
So this is the ARTAS hair restoration system, which performs follicular unit extraction. It has several components. The first component is the ARTAS chair, where the patient sits. It's basically similar to a sports massage chair. The patient sits here, lies their head on the pillow, and we can adjust the chair to the patient's comfort. The patient is sedated on a couple of medicines, so they're basically very sleepy but able to follow commands, which is necessary. After we get the patient comfortable and seated and lying in the ARTAS chair, we turn the ARTAS machine on. It is controlled by computer digitally, and the robotic arm of the ARTAS machine, which is this aspect, comes behind his head and then first captures the follicular units or the hairs on the back of the patient's scalp and maps them out, knows where they are, knows the angle and direction of each follicle, and we set parameters according to how many 1, 2, and 3 hair follicles we want and the spacing of each of those follicles. If the machine wants to take a certain follicle and we decide we want a different one, we're able to do that as well. The device has a camera inside, of course, and the punch is located in here. Those components are disposable, so we use a different one for each patient. When the device comes behind the patient's head, it decides which follicles it's going to take, and then every 4 to 5 seconds, the punch comes out, very quickly punches out the follicular unit, and then moves on to the next one, punches that one out as well, and so on. This is the body of the device. It basically houses the electronics, some of the suction that is used in the machine, as well as the cooling system. And over here are the master controls where our head technologist sits and runs the device and does quality control of the grafts.